testing, testing. Can everyone hear me? Okay, we're going to go ahead and get started. Thank you all for coming to listen to this talk and hopefully learn a little bit about the importance of lower body strengthening, fall prevention, stability, things like that, and what Scotia has to offer and what our goals for you are as far as these things. So when Sarah and I got together and talked, we decided on doing kind of a series, and I thought September would be the perfect month to do lower body because it's Fall Prevention Awareness Month nationally. So we kind of incorporated all this together. If anybody has questions while I'm talking, feel free to stop me. I will not be offended. There will be an opportunity at the end to ask questions, but if you're like me, you may forget them before we get to the end. So feel free to stop me. So again, Fall Prevention Awareness Month. There are lots of literature out on the internet if you guys are interested in looking at these things. National Council on Aging and the CDC both have some good information to check out. So what is a fall? What's considered a fall? Leaving an erect position suddenly or involuntarily. An event which results in coming to a rest inadvertently on the ground, floor, or lower level, or to move or extend in a downward direction, typically rapid and freely without control from higher to lower surface. So a lot of times oftentimes we hear people say, well, I didn't really fall, I just slipped. If you did not intend to end up where you landed, it is a fall. So just slipped. Don't happen very often. Slid, slipped, tripped. Okay, so some statistics on falls. Every 11 seconds, a senior is being seen in an ER due to a fall. Each year, 3 million older people are treated in the emergency department for fall injuries. 1 out of 5 falls cause a serious injury such as a broken bone or a head injury. Most of those are a broken hip. More than 95% of hip fractures are caused by falling, usually by falling sideways. 67% of falls don't happen from an elevated surface, rather a slip or a trip. It's estimated that 34% of adults ages above 65 experience at least one fall a year. Now in here, you don't have to raise your hand, but think about it. How many of you in the last year have had a fall? Some of you are willing to raise your hand. I would say a good majority. What was that? Somebody said something. Okay. Older adult falls cost the U.S. healthcare system $50 billion annually. And this last one is the one that gets a lot of people. An estimated 50% of older adults sustaining injury from falls can no longer live independently. It means we fall, we get hurt, and then it makes it hard for us to recover to go back home and live as independently as we were before. So some things that lead to falls. Difficulty with walking and balance. Poor footwear. We see this a lot of times. So poor footwear is something that, like without a back, you want to wear a good walking shoe that's enclosed completely. Toes and heels, especially when you're at risk for falling. A good sole. Decreased flexibility. Vitamin D deficiency. This one is big. Vitamin D and calcium are both big because that's what helps us build strong bones. Certain medications such as sedatives, tranquilizers, antidepressants, and even some over-the-counter medications. Impaired lower body strength, visual and hearing impairments, pain. How many in here are having pain? Who in here experiences pain at least once a week? I would say nearly everyone. Low blood pressure, slowed reflexes, fear of falling, and improper use of assisted devices. Improper use of assisted device could be not properly knowing how to use an assisted device, or it could be that you're using the entirely wrong assisted device. And by assisted device, I mean walker, cane, crutches, whatever device you are using. What can I do to prevent falls? Have your doctor or pharmacist review your medications at least once a year. Oftentimes our medications are changing throughout that year. We don't know what's interacting with the other. Hopefully the doctors are looking at that, but if you see multiple doctors and one's making a change that the other don't know about, it's good to have your primary care who can look at all your medicines, look at that at least once a year to make sure nothing's interacting with the other. Stay active. So get involved with activities, classes, individual programs that keep you moving your body, or work one-on-one with therapy or wellness for more of a one-on-one program. So I highlighted this one because I feel like this is an area that Scotia excels in. There's lots of opportunities here for activities. And we recognize that some people don't want to do group activities. There's lots of things we can set you up with that are one-on-one. It doesn't have to be a group class. We can do individualized sessions as well and put you on a path to where you're kind of doing your own independent program. And I had therapy/wellness, so I'm going to differentiate for you guys why one might choose therapy over wellness or wellness over therapy. So therapy is more of an individualized program. So if you're thinking you want to get something started, you want to start working on your lower body strength, and nothing really bothers you, there's nothing specific standing out, you may be okay to just go straight to Sarah and say, hey, I want you to help me figure out what is best for me. What can I do to help lower body strength, to work on my balance, whatever it is your goal is. Whereas if you're already having trouble, so you're having a knee that's really bothering you, a hip that's bothering you, or something else going on that you already know you have going on, and you're a little bit afraid to start with just a wellness program, you can always reach out to therapy. And our goal is going to be to help you determine, of course, we're going to work with you individually, hopefully try to get pain under control, things like that. And then we're going to try to set you up on a program with wellness so that once we discharge therapy, you continue on with that program. So that's our goal. Okay. So other than falls, what happens when we don't work on lower body strength and improving our balance and stability? Muscle strains. Pulled muscles, a lot of us call those. Sprained joints or joint components. Both of those are going to elicit pain, so you're going to know that something's not quite right. Decreased ability of muscle control over movement, causing instability in joints. Overall decrease in mobility, causing decline in function and decrease in independence. And then ultimately overall decrease in endurance and stamina. What happens is we see that that's a path we don't like to go down because something starts bothering us. We move less. Before you know it, our independence is not there. We're dependent on an assistive device, or we're depending on something else to help us. So it's just a path that we don't want to see folks go down. Sometimes that path is inevitable. We're going to go down it regardless. But as long as we're working to do these things like strengthen our lower body, work on our balance, and staying involved in physical activities, we hope to lessen that. So after hearing a little bit about falls and the other risk, I hope now you kind of understand the importance of optimizing lower body strength, stability, and balance. And what we, of course, want to see is strong lower body, good balance, stability, leading to decreased fall risk, decreased injury, continued independence, and longevity in health. So what does Scotia offer to help me with optimizing my physical well-being and reducing my risk of falling? So wellness classes and activities, that includes the pool fitness. So for someone who may have struggles participating in activities on land, the pool is a good option. You can work individually, or there are some classes in the pool that you can get involved in, but we can work with you individually to develop a program that is going to work for you, that's going to help with increase in strength, increase in stamina, flexibility, things like that, depending on what your goal is. The fitness center, and when I say fitness center, of course, I'm referring to the one with the weighted machines down there, the elliptical, the new step, and the fitness center. So the one down in Iowa is what I'm referring to, but we have some of those things in therapy as well. Multiple classes for strengthening, stretching, and balance, and that's the ones in the big open room there, and we'll talk a little bit more about what's offered there. A beautiful campus for walking. That one is important. I think that's an underutilized privilege we have here at Scotia, because we do have a beautiful outside area to walk. Outdoor activities like putting and horseshoes, and then a place for gardening, or if you already have hobbies that are outdoor. So for therapy, what we look at with falls, and of course other things. So physical therapy is going to be specialized test and treatment interventions based on your deficits and impairments related to inability to live your optimal quality of life and to decrease your risk for falls. So a lot of you have been through physical therapy, some of you have not, but you know we do special tests with just about everybody, and more times than not, we're going to include a balance test in those specialized tests. And then we're going to form a treatment plan based off of what your needs are, what your risks are when we do those assessments, those tests. And then our hope, of course, would be to get you into a routine of doing something physically just about every day, at least 5 days a week, following therapy, so that you keep up what you gained in therapy. So occupational therapy's role with fall prevention, and of course other things, is personalized intervention to assist you in living your best quality of life day to day and carry out your activities of daily living with ease in your home environment, and adjustments needed for you to reduce your risk of falls. So this is a specialty for OT. They learn, and the things that they go through in school, how to assist people to modify their home to make it easy. So taking things off of a top shelf, if I'm struggling to reach in my top shelf and every time I reach up I'm going backwards, they might say, well, let's take everything and put it down to a lower level. They'll make things like that. They'll make modifications and help you decide what's best for you to keep you from being at such a high risk for falling. And that was just one example of many. Speech therapy. So speech therapy does a personalized treatment to address cognitive function and improve safety to reduce fall risk and assist you to maintain your independence. So for me, when I saw this picture, I thought they're probably talking about medication management. Looking at your medicines, making sure you're taking them on time, because those of us with blood pressure problems know sometimes if we don't take that medicine on time, it affects blood pressure and we could get lightheaded from our blood pressure dropping, and that could be a fall risk. They also work on ways to compensate when our memory starts to fail just a little and we can't remember that we have an appointment here or that we're supposed to do a certain thing at this time. They can help us work on those things, as well as help us with recalling safety tips. So things that we might teach you in physical therapy, but every once in a while you're still forgetting. They can help us develop ways to help you remember those. So the wellness classes, these are what you see in the big open room down here. Some of you already participate in these, some of you maybe not. So you have morning fitness that targets strength, cardio, and balance for all levels. You want to say anything? Okay. Morning stretch targets flexibility. Tai Chi targets balance, flexibility, posture, and breath control. That is provided in the pool or the fitness center. So remember what I said about some of the activities. Sometimes people struggle on land to do certain activities. In the pool, that makes this a little bit easier. So there's going to be classes and individual sessions offered in the pool or on land. So just remember that. And Mr. Robley is in agreement with everybody else that this is the #1 class for adults your age. So if you guys have any questions, he's the guy to see. He teaches the class in the pool and on land, and he might even have something to say now. I see him taking off his mask. No? Okay. Okay. Walk it out, strength and stability with walking exercises. Water aerobics, again, that's another pool activity, stamina and strength. Let's get physical. Now, this one is done on the TV, so you don't even have to leave your home to follow along with this one. Targets movement of all kinds for strength and stamina without leaving your home. Gentle stretching, of course, targets posture, flexibility, and balance. And then drum fit targets upper body strength and stamina with music. And if you have not been involved in this or seen this, it's lots of fun.
She pretty much hit a lot of the information, but I did want to do a plug for all these classes. I explain it as functional fitness, and what that means is that we're obviously getting stronger and working flexibility and strength and mobility and things, but we do a lot of movements that mimic everyday movements. So like proper ways to pick things up off the floor, because we always do that. Every day we're picking shoes up off the floor. But do you know the proper way to do that? If you're having to reach outside of your center of gravity, how do you manipulate your body to do that safely? So not only do we work on trying to, get stronger as a person, but how do we learn proper ways to be able to live the highest quality of life when we're outside of the exercise room. So it's just that muscle memory. But I do think that every one of these classes, it might not, necessarily be your cup of tea, but there is something available for everybody. And every one of these classes are modified to fit wherever you are. So if there is a movement that you don't feel comfortable with, there are other options so that you can be successful in that movement. But I just think it takes just trying them out, okay, and just being present. And a lot of people may not just know what is offered, or they see these on the calendar and not understand what they are. But every one of them has their place, I think, in developing you as a physically and mentally too. But if there's something up there that you're not sure about, or you wanted more information, feel free to reach out. Or if you don't know where to start, I'd be happy to speak with you if there is something specific that you're looking for, which class might fit you better. But thank you.
Yes, and I'm just going to back her up by saying, if you don't know where to start, find one of us. Find somebody. We can help you. It may not necessarily be that you need therapy, but I can get you with Sarah, or you may need some therapy before you do a class, and she can get you to me, and we can help you figure it out. We don't want anybody not participating and not doing what they can physically because they're afraid of it, or they're not sure where to start, or any of that, for any reason. We want everybody to be as involved as you can be. Next slide. So I don't know how many people know about this, but this is an up-and-coming thing at Scotia. You've probably already seen, those of you that are down in the fitness room down there, you've probably already seen this. So this is a new machine that we're getting. We've got the components of it. We're still waiting on the computer part of it. So this is going to be big for you guys with balance. It's going to be able to do test on your balance, give you training and reporting, all in that same system. So there's going to be games, there's going to be training activities. We have the ability to test you we can turn you away from the screen, or the screen will go black so that you're not trying to compensate, so we can really see where your deficits are, and we can really know how to help you when we get you guys on this. So we're really excited about this, and I do hope that when we get it, that we'll have people that are willing to participate. I'm not sure yet how we're going to, you got an idea, or you want to talk more about that?
Yeah, I'm really excited about this. It's supposed to be very user-friendly. So once you get your initial setup, that you have your own login, so that on your time you can go in and log in, and it has your information on it, and it pulls up activities that you need that is specific for you. So once the computer comes in and we get trained on it, on how to use it. But this is going to be utilized through the physical therapy department and the wellness department, so that we can set up and schedule an initial assessment and then go through how to use the machine. And then so you can use it on your own as well. So we'll be getting some more information on that soon.
Okay. So collaborating with therapy and wellness to keep you as strong and balanced as possible. So of course, I've mentioned this multiple times, but our goal is, as a whole, is to see you as active as you can be and live in your most optimal life. And with collaboration between you, therapy, and wellness, we do believe that we can achieve that. So this is kind of like what we envision this looking like. So therapy to wellness, wellness to therapy as needed. So we want to work together to make sure you're able to optimize what you can do. Make sure the classes you're in, if you're currently in classes, are benefiting you. If you need something different, we want to work with you to figure out what that is and help you get involved in that. Wellness to physical therapy. So if you are already involved in activities and or classes with wellness and begin to experience pain, decreased endurance, decreased flexibility, or any unusual changes, this may be a good time to look into therapy. And the way to go about that would be you can come directly to therapy, or you can mention it to Sarah, and Sarah can get you in touch with the therapy department. Or she'll get it to us and we'll reach out to you guys. Our goal, of course, would be to target what is keeping you from being able to participate at your maximum potential and achieving those benefits of the activities or classes, or even a one-on-one, something you're trying to do, a program that you're doing independently, and assist you with returning back to those classes once therapy is over. So we may even, after we've had our therapy sessions and we're starting to talk about discharge, we may even go into one of those classes with you, watch you, make sure you're able to do it, and make sure we can modify things, like Sarah said, if things need to be modified for you, or if there's a class that just might be better for you, we could help recommend those things. And then, of course, therapy, the intention of therapy is not to pull you out of your classes. We want you involved. If you want to be involved in every class we offer here, we much would like to see you do that. But we want to make sure you don't think that therapy is trying to pull you out of your class. We want you to be involved and make sure that you're getting that max benefit.
That I could be wrong. I think there may be a misconception about physical therapy, that people may think that they only need it after a surgery or after coming back from a broken foot or hip or something. But physical therapy is for any point in time that you feel that you have some kind of decrease or decline, or those things that are having pain every day, or having issues that keep you from doing your normal day-to-day activity. That's not normal. That's not something that you should settle and say, well, that's it now. Yeah, there are ways that we may be able to improve that, and I think it's important to be able to go somewhere and say, I need help with this. What can I do? So if you are having any kind of issues like that, please reach out and try to exhaust all avenues before you get to the point of saying, well, I just can't do that anymore. I'm just going to stop doing it altogether. There are other avenues that we can take.
Does it require physician reference?
It does. For physical therapy, it does require an order. And typically around here we find, of course, if you're involved in our physicians here, that's fairly easy to get. A lot of times Kathy can just reach out. We'll go to Kathy. We'll say, look, this is what's going on. Can you reach out to that physician? And some of you have physicians that are willing to just go ahead and send that referral. Sometimes they will want to see you, though, depending on who your physician is. Sometimes they will request to see you just because they need to see you before they make a decision to send you to therapy. But it does require a referral. So physical therapy to,
Concerning physical therapy. I had some chiropractic adjustments after having stepped in a hole at the beach and went up to my knee. I had bursitis as a result. And it did well, but it didn't really bring me back to my strength. It was only after I went to physical therapy for about 2 months that I got my strength back. So if people don't know that, I think it's very good to say it does work.
Thank you for saying that. Yes, that is important. And sometimes, and don't think you don't have to tell the whole class that you're having trouble. That's the other thing I wanted to say. You can come to us individually and say, look, I'm really starting to struggle with this, or I've got this going on. So we don't want anybody to feel like you have to, in the middle of your class, say, I can't do that. You do not have to do that by any means. You can come to us individually and say, look, I'm struggling. I need to either see therapy or I need to have a modification to what can I do to make this work better for me. So if you're already receiving therapy and have been involved with us, some of you have been through this anyway and have seen that we do try to get you involved in an independent program. Sometimes that's a class, especially if you're already involved in a class. We want you to get back to that class, but we also may recommend other classes. And then we also will take you down to the gym down here in our fitness center in IL, and we will go through a routine with you there based off of your needs, and of course, collaborating with you. We're not going to make you do anything you don't want to do. Obviously, we want it to be a successful program. We want you to be able to go in, feel confident doing it, not causing pain, not causing any other issues, but something you can keep up multiple times a week. So overall health and wellness. If you have a hobby that involves physical, again, this goes back to not necessarily wanting to be involved in classes with everybody, but if you have a hobby or a physical activity that you have already began to struggle with, that hobby or certain components of that hobby, reach out to us. We would like to help you modify it or give you some compensatory strategies to be able to continue that hobby. And the other part of that is I listed some hobbies down here that I know are pretty popular among Scotia. So gardening, painting, dancing, acting, photography. If you don't want to get involved in a class, there are ways that we can make these hobbies an exercise or an active hobby. Painting. Could you stand up and paint? Could you stand up and paint for 10 minutes and then do some marching in place? There are ways we can make that active for you so that you don't feel like you're forced to be in a class or to be in a regimen or routine that you don't want to necessarily be in. These are some of the resources I mentioned and some that I use. Again, that the CDC and National Council on Aging have some great resources. And that is it. Questions and comments. Thank you for that comment on therapy and the ones that's already asked questions. But are there other questions or other concerns, comments that anybody wants to make?
Thank you for doing this.
Well, thank you. Absolutely. Anybody else? Anybody got the wheels turning of something you might want to start trying?
And I do have, if you specifically want to work on just your balance and you want, okay, what specific exercises can I do on my own in my room or down in the fitness center? I can print things out for you for ideas. We can, discuss what are, your goals and things, and if it's something that you can handle or things that you can do on your own, I'd be happy to print those handouts and things that you could utilize too. So definitely use us as resources.
Yes,
You
sir.
have to be careful about, I know, when I went to see my doctor, he recommended therapy.
Mm-hmm.
Before I could turn around, they had me at the hospital. Some of the doctors don't know that we do it here.
That's true. That's true.
Got it fixed, got it here, but,
What Mr. Willis is saying, when they referred him for therapy, but they automatically tried to send his referral to the hospital for therapy. So you guys be advocates and make sure that they understand that you do have a therapy provider right here at Scotia. We can provide that therapy at your house. We can provide that in the gym. We can provide that in IL. So we're kind of mobile over here, but they do tend to forget that sometimes at these local physicians' offices, and they'll automatically try to send you over to the hospital.
The one thing we have here, they do not have the hospital pool. They
That's right.
their pool over and made it into rooms, so they cannot do aquatherapy anymore at the hospital.
Very good point. Anybody else? Okay, well, thank you guys for coming. And again, if you want to speak to us individually, Sarah's down by the Wellness Center. Of course, I'm over in therapy, but I hope everybody got a little, in the past month or two, we put magnets in everybody's cubby with our phone number on it. So I hope that everybody has gotten one of those. But if not, we are over in the Wellness Center. Our number is just the regular number that you call to get to Scotia, the 277-2000, and then they can transfer you to us. Yes, ma'am.
From the shoes. I learned many years ago to go with the shoes, the right shoes. So
Absolutely.
I saw the other day a lady who lives here, and she was having difficulty walking. She had on pretty sandals,
Mm-hmm.
but I noticed that they had no support. And I can walk all day in Lowe's with the shoes that I have, but the ones I used to have, in 5 minutes I'd be limping.
Absolutely. That's a very good point there. You want to, again, we'll touch on footwear. You want to make sure you have supportive footwear. You only get one set of feet in your lifetime. So you want to make sure it's worth it to have good shoes. And again, I caution folks, some people do fine in sandals, but I do caution folks, especially when you start to have trouble walking, when you're dragging your feet. When it's hard to lift your feet up, those sandals will put you on the floor faster than anything else. So just be very cautious about that. And the other thing I'll caution people about, and a lot of people do not like to hear this, but throw rugs. Throw rugs. That's another thing that will put you on the floor very quickly. Because a lot of times you're walking, it's been there for 30 years, you know it's there, and it just rolls right up under your feet, and over you go. Anybody else? It's going to be down in the aisle, like across from the pool, that fitness center down there. There's already a component of it there. So the big part you can see, but the computer is what we're missing. Yes, ma'am.
Is that what we stood on, that's something we did here? What was that day?
I don't know. I don't know.
Skied down on the slope.
That what you're talking about, the Wii Fit. This is different. It's going to be, I think there's going to be some similarities, but it's going to be a little bit different. And the good thing about this machine is that so when you step up there and we start testing, we can input your information. It's going to save that. And then it's got training programs for you to work, but it also has games. So you can train for a while. And then later on that afternoon, if you want to come back and say, I'm going to play a couple of games on here, it's there. You'll be able to log in. You'll be able to keep up with all of your information there.
And this is to help on balance?
It is. It's a balance machine. It's called Smart Balance by Her USA is what it's called, Smart Balance. So it is a focus on balance.
stress again the importance of closed-toed shoes?
Absolutely. If it was me, I would only be wearing closed-toed shoes around here. Again, I know, especially the ladies, they enjoy sandals, but closed-toed shoes and heels, for that matter. A lot of people like to wear the open ones on the back too. Just know you are putting yourself at risk when you do that. Make sure you are really picking up your feet if you are walking around here with open toes and heels. Closed-toed shoes, yeah.